In this segment, we're going to use counterstrain techniques to treat somatic dysfunction of the thoracic spine by finding the associated tender point, and typically in the mid to lower thoracic region from T4 to T9, we could have tender points pure midline or off the inferior lateral tips or over the posterior transverse process. So here on the left, I have a hypertonic area, and when I probe, we get the tender point response from the patient. We tell the patient to remember that, and we're going to find a position to hopefully completely alleviate that tender point. So we're going to have that tender point. We're going to probe. Patient says that's tender. We're going to tell her to remember that's a 10. We have the patient rotate the head toward the tender point side, in this case to the left. We're going to let this arm come up. We're going to come underneath the patient's axilla, and we're going to add some rotation to the left with some extension, and you'll feel the softening under your finger. Repress, and this tender point classically requires extension with rotation toward and then side bending away. So I'm bringing her shoulder up toward me, which is going to side bend away from the tender point. And you feel the softening of the tissue under your finger. When you find a position of optimal comfort where the patient says it's a 0 or as close to 0 as possible, we're going to wait here for 90 seconds. After the 90 seconds, we'll reprobe to make sure we still have 0, and then we're going to slowly take the patient back to neutral, to the midline, let that arm relax, and then repress, and hopefully the patient says it's a 0 or at least a 70% reduction of the initial tenderness.